You've likely heard that adults should aim for 10,000 daily steps. This approach provides a clear message, though it doesn't consider how varied human lifestyles and bodies are. In 2024, a team of researchers found the most sedentary could ward off the harmful effects of sitting by including more steps. Sedentary lifestyles are common, linked to higher odds of dying from cardiovascular disease, greater risk of cancer, diabetes, and a shorter lifespan. Risks lower for people with higher step counts and fast-paced walkers. What hasn't been clear is whether sedentary people might be able to offset those alarming health risks with daily steps. The more steps that people in the study took, no matter how sedentary they were otherwise, the less risk they had of CVD and even early death. So those of us with desk jobs are not totally doomed. Though the researchers emphasize that it's still important to try to reduce sedentary time overall. This is by no means a get-out-of-jail card for people who are sedentary for excessive periods of time. Population health scientist Matthew Ahmed from the University of Sydney explained when the research was published. However, it does hold an important health message that all movement matters and that people can and should try to offset the health consequences of unavoidable sedentary time by upping their daily step count. They emphasize that it's important to try to reduce sedentary time. Ahmed and colleagues analyzed data from 72,174 volunteers contributing to the UK Biobank, a long-term dataset established in 2006 that will continue to track participants' health measures over 30 years. There was an average of 6.9 years worth of general health data for each participant included in the study. Participants had worn wrist accelerometers for 7 days to estimate their physical activity levels, such as number of steps they usually took and the time they usually spent sitting. The median time spent sedentary was 10.6 hours a day. Those who spent more time than that were deemed to have high sedentary time. Those with fewer hours were deemed to have low sedentary time. Participants whose stats in the first 2 years might have been affected by poor health weren't included in the study. Findings apply only to people who, for at least the first 2 years' worth of data, were generally healthy. It's unclear whether the data included participants with disabilities affecting step count. The team found between 9,000 and 10,000. Daily steps were optimal to counteract a sedentary lifestyle, lowering incident CVD risk by 21% and mortality risk by 39%, regardless of a participant's sedentary time. The researchers discovered that 50% of the benefits kicked in at around 4,500 daily steps. Any amount of daily steps above the reference 2,200 steps per day was associated with lower mortality and incident CVD risk. For low and high sedentary time, Ahmed and colleagues wrote,